How Malaysian doctors can work in Singapore as a doctor. Hi, I'm Dr. Selina. Welcome to Disruptive Doctors. I'm your host and co founder of Disruptive Doctors. Disruptive Doctors is a platform that helps doctors like you impact healthcare differently. Now, on Disruptive Doctors platform, we have an app and it helps to connect doctors like you to collaborate, connect, share experiences with doctors across the globe. Now, apart from just connecting with doctors and other doctors, this platform also connects doctors to geeks, job opportunities within healthcare. And today we have this incredible episode where we're talking about how you can work as a doctor in Singapore. And this is especially useful for Malaysians. We're going to talk about the process, the perks, and everything in between. And joining me today is Mr. Wiryono Budiman, a specialist in recruiting foreign doctors for Singaporean hospitals. Welcome, Wiryono.
Thank you so much, Selina. It's a pleasure to be here. I'm happy to see you again after such a long time.
Yes. So you came for our conference the last time. How was it?
Conference was amazing. It is an opportunity. I think it's an opportunity for doctors to see what kind of career, what kind of business opportunity they have. Right. I think it's you really put on a very diverse group of attendees. They can learn from each other, and then some of the people in the industry. You have the medicine and the financing company. Everything is in there. So it's a very good uh, conference. I think doctor can do anything. If they want to set up a clinics, they can just find the right people who can help them become a consultant to supply the medication, to do the financing, or they want to seek alternative career. Everything is there. I'm really looking forward to your upcoming conference again.
Thank you. We were also quite excited for this year's conference. So for those of you who are listening, Disruptive Doctors have an annual conference. And for this year, 2025, we're organizing one on the 20th and the 21st of September in Sime Darby Convention Center, where we're going to talk about the diverse careers for doctors within healthcare, leadership, a symposium for the GPs, how to run a sustainable clinic. We're going to talk about longevity medicine, how doctors, we're going to put the power of primary care back to the hands of the doctors. And we're also going to talk about AI tech and innovation within healthcare. So, we don't know, how long have you been recruiting doctors in Singapore?
I've been doing this for close to 5 years. Yeah, it was I think just before COVID. I've started doing this work. I was and I am recruiting for the public hospitals in Singapore.
Wow, so that means you've seen it all, like 5 years recruiting. What are the types of doctors that you've recruited so far for Singapore?
A lot, I think, in all specialty. From there are three types. If I were to categorize, the first one is called clinical associate, which is a junior doctor, and then second is the resident physician, the mid-level doctor, and then the one on top is the specialist, the consultants. So these are the high level one. The three
Okay, so
that's across all specialties.
and from which countries do they usually come from?
I'm recruiting globally, Malaysia, some from UK, India, Pakistan, Bangladesh, Sri Lanka, Hong Kong, Australia. It's a diverse mix of country. So in fact, Malaysia is one of the most Malaysia doctors are one of the most preferred.
And why is that so?
First of all, similarity in terms of medical system. Most of the Commonwealth country, like Singapore, Malaysia, India, being run under the more or less similar system. If you see the hospitals in Kuala Lumpur, like Hospital Kuala Lumpur or Hospital Sultanah Aminah in Johor, these hospitals are being run pretty much similar to the one in Singapore. Maybe just slightly, the pace is slightly faster, more patients, and in terms of the patient flow, in terms of the system, might be similar, more or less similar. And then secondly, in terms of the culture, and then Malaysian doctor, I think shouldn't have any problems understanding the main languages in Singapore, right? English, Chinese, Malay, Tamil, and then Singapore English, Malaysian English. I think the fellow workers, the fellow colleagues, and then the patients, I think might understand each other pretty well.
Okay, I think a lot of doctors will probably be curious to find out because here in Malaysia, doctors who are working in the hospital, you have to work office hours. On top of that, you have your 24-hour on call, and you sometimes have anywhere between 6 to maybe 10 on calls a month. So what's it like in Singapore?
In terms of the workload, working hours, I think it will be similar when you talk about public hospitals. In general, we can say that you need to work 48 hours per week. And then, like as a doctor, it is not office hour. When you reach 5 p.m., it's time for me to go, right? 5:30, it's time for you to wrap up. And then there's emergency cases you need to attend, some extra hour. I think this is pretty much similar. In terms of on calls, I think on average, most doctors will have 4 to 6 or 4 to 5 on calls per month.
Is there a limit?
Of course, there's a limit. They will not, they will make sure that you are having a proper rest as well. They will don't want you to overwork to such an extent that it can impact your concentration, which will lead you to do like some more practice. They want you to have a good rest so that you can deliver excellent patient care as well. But of course, coming back to each individual again, some doctors might think that, okay, this is the kind of life that you get used to, but some prefer a more relaxed lifestyle. So that's where sometimes, occasionally, I works as a GP in the polyclinics. It is much. We don't recruit much. Once in a while, their positions have available, so we recruit a resident physician for the polyclinic doctors. Working hours is more manageable. On call duties, and then you don't have on call allowances. Just again, what kind of career you are looking at? If you're looking at the public hospitals, so that's the kind of life you are going to get. 4 to 5 on call duties per month. And then if let's say you want to take the polyclinic, work in the polyclinic, if let's say there's any vacancy, it's also like not a bad choice as well. You have office hour work, and Saturdays are half day work. There's no on call duties.
Do they hire foreign doctors to work in their GP clinic?
Foreign doctor, you're not allowed to work directly as a GP clinic. You need to work first in a public healthcare institution where there are sufficient supervisory framework to supervise up to a certain point of time where the doctor is deemed capable. They'll get a full registration before they are able to leave the public healthcare and go into the private clinics. But this also takes time because it requires doctor to have certain qualifications, certain experience as well. On paper, they say that 4 years, 5 years, you can get a full registration provided there is a satisfactory performance. There's a support from the HOD from your supervisor. But in reality, if let's say you're not performing, then you might not be able to get that recommendation.
Okay, because just now you said GP, foreign doctors are not allowed to work in GPs. So polyclinics and GPs are not the same there?
GP, I'm referring to the private GP clinic, standalone or chain clinics, whereas polyclinic is a government institution where they have a supervisor in place, right? They have the HOD, they have the specialist, they have the resident physician, the GP doctor. So even when these doctors are practicing, they have people supervising to make sure that they are in line, they are performing things correctly to simplify things.
Okay, let's talk about what are the pathways for a doctor, a Malaysian doctor or any foreign doctors who want to work in Singapore as a doctor? Like, what are the pathways available?
So, first of all, let's say clinical associate. Clinical associate is a very junior position. Maybe in Malaysia, we can say like your PG1 4.5, right? 4.56.
Okay, that we don't have that. I think maybe like a houseman.
3 years after houseman. And then your university is not registrable with the medical council, or you don't have MRCP, you don't have postgraduate qualifications. So you can come in as a clinical associate. So for example, you got your MBBS from University Science Malaysia or Manipal, right? So you're eligible to work as a clinical associate. This clinical associate is a 2 years non-renewable contract. And you can work as a we call it clinical associate, but similar to medical officer. You do work in the department based on your experience. For example, if you have experience in medicine, then you become a clinical associate in medicine. If you're doing surgery, orthopedic surgery, then you become a clinical associate in surgery. So after 2 years, there's no guarantee that the medical council will renew your license, although in some cases they might. This is up to their discretion and depend whether 2 years later they still have this clinical associate policy in place. And then the most common one is a resident physician. If your MBBS is from University Kebangsaan Malaysia, University of Malaya, then you're eligible to work as a resident physician. Or if you have MRCP, FRCR, FRCS, then you're eligible to come to work as a resident physician. So this is more like so-called a permanent medical officer. The contract is 2 years renewable. At the end of every 2 years, it's up to the doctor, usually up to the doctor whether they want to renew or not to renew. And eventually, there are possibility for conversion into permanent staff. And then the specialist role, we need to the doctor need to have specialist residency training, like the CCT from the UK, Canada, Singapore, Hong Kong, Australia, comparative healthcare system, and then we can assist with the specialist accreditation, medical registration to practice here as a specialist. But for the first couple of years, it will be under conditional registration, need to work in the public hospital setup. Like many years later, based on the subject to good performance, our supervisor, specialist support, they can get a full registration before they can test outside the public hospital.
Okay, let's go back to the one you said, a clinical associate. So if say I was a doctor, I was a medical grad. Okay, say I graduated from a university in Russia or Manipal or something, and then I come back and I have to complete my housemanship and my 3 years post housemanship, correct?
Yes.
So that means I would have worked for 5 years as a doctor before I can apply for that clinical associate job.
For all roles in Singapore, there is a criteria for registration. The first one is you need to have an MBBS from reputable university. Second, you need to complete your internship, and then you need to have 3 years of working experience post internship. And then if there is a licensing examination in the country where you complete your primary medical qualification, for example, Russia, China, Philippines, Cuba, Ukraine, Belarus. So doctor need to seek for the licensing examination in that country before they are eligible for medical registration with Singapore Medical Council. So you mentioned about Russia. For example, if a doctor graduated from IM Shinov University, right, and then after graduation, the doctor come back, do internship in Malaysia, and then practice in Malaysia for 5 years. So if this doctor did not seek for the licensing examination in Russia, it's called accreditation. So he will not be eligible for medical registration in Singapore. The rationale is that from the medical council perspective, this licensing examination is completion of your medical degree. They consider it as so-called the final examination before you will get your registration. But if Malaysian doctor who study in India, Manipal, or other university like Dr. MGR University, there is no licensing examination in India, even Bangladesh, right? So if they come back to Malaysia, they do the internship and then they practice for 3 years. So these doctors are eligible for registration.
Registration for only the clinical associate job or even the resident physician?
This apply for all.
I see. Okay, so that does that mean that the clinical associate job is for doctors who graduated? So, like you said, Russia, China, all this, they have their own licensing exam. So, but if say as a doctor, I did not take that licensing exam because I was coming back to Malaysia. So I've come back, I've completed my housemanship, I've done 3 years of MOship. Now I want to apply for the clinical associate job. Would I be eligible?
Sorry, apologize for that. This is a very sad case because the medical council will consider that the doctor did not really complete the final examination in that country. Even if subsequently they take the licensing examination with the medical council, Malaysian Medical Council and pass, it is still not counted.
I see. So how is the clinical associate role and opening and the resident physician opening different?
What do you mean by opening?
Like there's you mentioned you can come in as a clinical associate. You can also come in the pathway of a resident physician. So how is this two different?
This is all depend on your qualification. So if you have completed your MBBS from UKM or other university in India, in UK that are Ireland that are registrable, recognized by medical council, you can come in as a resident physician. Or you have the postgraduate qualifications that are recognized by the medical council, like MBBS, FRCR, FRCS. Then you can eligible to get conditional registration to work as a resident physician. Other than that, then you have to work as a clinical associate. So, for example, you have 3 years of working experience. You have to come to work in Singapore. So you can come here as a clinical associate for first. And then while you are working in Singapore, it is also a good time for you to assess whether you like, whether you can adjust well to the system. And if you're okay, then you can start to do your MRCP. Some Malaysian doctors who have completed MRCP Part 1 or Part 2, you can come to Singapore as a clinical associate. Once you complete your paces, then you can apply for resident physician role.
So, what sort of license will I be under if I'm a clinical associate?
It is a temporary license. The validity is 2 years. I have seen some cases of extension, but not many. If let's say it is extended, it will be extended for another 3 years. So
As a provisional license,
temporary license.
temporary license. Okay. So now let's talk about resident physicians. So if they are under from a recognized university, then they go down this path. So for countries that do not have a licensing exam, you mentioned what, like India?
India, Bangladesh, Pakistan.
So if I've graduated from Manipal and I apply for this resident physician job, am I eligible?
If you have MRCP, yes. If you have FRCR, yes. If you have FRCS, I think that's you are eligible for registration due to your postgraduate degree.
So without a postgraduate, I will not be able to register.
Yes, you are only eligible for clinical associate role. And then if, let's say, so my job here as a recruiter, I'm not just keep on psychoing people to come to Singapore. I need to look at your CV. If, let's say, you're already progressing well in your current system, I'll discourage people from coming. My recruitment rate is not as high as my competitor because sometimes, when you are referring candidate to me, I say, I would rather her not to come, him not to come. This might not be suitable. This is, if let's say a doctor has progressed well in the, although they're not a specialist in Malaysia, if they have a sufficiently good career, I will ask them what is your primary motivation of coming, and then these are the financial benefits that benefits you. And then if not, then tell them that this might not be a good time for you, a good place for you to come. Maybe you can look for career elsewhere. So even if you're from Manipal, you have, let's say, 5 years of experience, and if you're progressing well in Malaysia, I will not recommend you to take clinical associate role because that is a very junior position. It is a downgrade, might be a downgrade from your current position. Unless if you think my spouse, for example, my spouse is a Singaporean. I'm looking for a family relocation to Malaysia, or my parents in Singapore. I want to resettle in Singapore. Then I'm more than happy to assist.
Okay, so if say someone wants to, with the system here in Malaysia, there's a lot of doctors and a lot of us actually do want to become specialists, but we're very limited by the placement, the system, and so on and so forth. So, say I want to continue becoming a specialist, should I go and try and get a job in Singapore, work as a doctor there, and get into a training program?
Most likely, you will not be eligible for any training program in Singapore.
Why is that so?
All the jobs in Singapore, resident physician, clinical associate, it is a purely service, non-training job. So if you are looking for training, Singapore is not a good place for doctors to come. If you think you still have even a little chance of getting into training in Malaysia, I would suggest that you pursue that first. Because like in any other country, priority for training is given to the local people, right? Today, imagine I am Indian doctor, I studied in Malaysia, and then I studied in India, and then I come to Malaysia, I want to apply for residency training. And then I get into the training, people will be unhappy. There are so many Malaysian doctors waiting for interview, cannot get a space. Hey, why this fellow from India can get a training and I'm not? So I think the same thing applies in Singapore as well. Singapore doctors, Singapore citizen PR will be given a priority. And then if let's say there's any vacancy, then they might consider. And recently there is a scheme called hospital clinician. So for resident physician, they are performing well and then they become a permanent single resident. They might be eligible for the hospital clinician scheme. This is a 2 to 3 years of training. It's like some sort of a residency training. For residency training to become a specialist, it is a final examination and you get a specialist accreditation. But for hospital clinician, you will take examination with Singapore Academy of Medicine, the same body that organize an examination for specialists, but this is a diploma. After you become a hospital clinician, then you can perform a senior registrar role in the hospital. You can take on more responsibility. You can have a more leadership role. Again, there are terms and conditions. First, as an RP, they know that you are performing well. You can do your job well, know your stuff pretty well, and then you are Singapore permanent resident already.
Okay, so is there any career progression or not? Like for a Malaysian doctor that comes to Singapore? Like, is there a pathway for career progression?
Career progression is along the non-specialist career track. I think if in Malaysia it's called UD 40 something, 30 something, 20 something. So in Singapore it's simpler. You first start off as a resident physician and then you become resident physician 2. Many years later you become a senior RP, and then the highest the doctor can go is a principal RP. By the time you reach principal RP, you are more or less like it's a registrar level. It's pretty much senior below the junior consultant.
How much do they make?
As a resident physician, usually that you start off at I say to 120K to 150K per year, RP1. So you have your basic salary, housing allowance, on-call allowance, and then you have your 13-month salary and annual bonus about 120 to 150K per year. And then if you are RP2, maybe you add another 15K. And then if you are SRP, it's another maybe about 170, 180.
Okay, so then the highest you go, what is the earning potential of someone who is...
I say that you earn about like maybe it changes, okay? Because every year there's a salary increment. So I'll say that as a safe estimation, about 12, 13K, the basic, yeah, per month. And then you have your housing allowance, additional allowance, and on-call duty allowance, 13-month salary, your annual bonus. Then it can add up to quite a lot.
Okay, what is it? Okay, that's quite interesting. I'm just curious, like, are there a lot of Malaysians that go there to work as a doctor?
There are a lot. If you go to all hospitals, there are so many Malaysian doctors. So I think in terms of there are even Malaysian doctors who coming here during the houseman period, right? They are able to get into the residency training as well. So I can say that there are a lot of Malaysian doctors in Singapore.
Okay. So what's the living cost like that? If I were to make 13,000 a month, what's like the living cost like?
I don't want to say that you're earning 13K. Let's say we do a lower estimate as a RP1, right? The very basic RP, you will earn roughly, let's say 9,500 per month. Are you single or married? That's the thing. If let's say you are single, you can rent a studio apartment. It will cost you about 2,300. Assuming that you're eating out every day in the hawker center, in the food court, that should be about 800 on the high side. Like 2003 plus 800, this should be 3000 plus. And then you add up your tax. Tax, if your RP is about 600 per month, 6 to 700 per month. And then, so how much? 2003 plus 800 is 3001, 3007. So I say it's about 4000 plus if you are if you're renting a studio apartment. If you're renting a master bedroom in a public apartment, of course it will reduce by 1000, maybe about 3000 per month. If you are renting a master bedroom in a government apartment, if you're renting a common room, it's even cheaper, about 800 per month. And then, so if let's say a couple with a child, so this add up to some of the costs. If you're renting a 2-bedroom government apartment, it costs you about 3000 plus. And then children education is quite expensive here. Preschool costs you anything about $500 to $3,000, depend on which one you are choosing. So on average, most of my friends, we send our children to the mid-tier preschool. It costs about 700 to 1,000. And then for the family meals, assuming that the spouse cook 50% of the time, and then apart from hawker center, 1,002 is sufficient for the whole family. Your grocery and your household, your utilities, high side is 1,005. So if you add up everything, I'll say maybe about 7,000 per month. That's why one of the criteria I'm asking about doctors coming to Singapore is about the family, whether you are single, whether you're married, how many children do you have. Some people might think that, oh, why are you asking such a private stuff? Because my motivation is to make sure that when you come here, you can earn, you can live comfortably. If let's say you have 2 children, 3 children, you need to bring all of your family to Singapore, I would discourage the doctor from coming because the cost of living is too high and then the salary might not be sufficient to cover. Unless if you're Singapore, if eventually if you become Singapore PR or Singapore citizen, then it's a different story. But if you need to move your family, children of 2, children of 3 to Singapore at this point of your career, then I will discourage you from coming. Then the salary is not sufficient to cover the cost, or you might not have any savings at all. If you add up with a bonus, yes, might be just nice to cover the living expenses of the two children. But are you okay with it? You're working without sufficient savings. And then you also need to take into consideration the healthcare costs. Coming to Singapore, people think that the salary is very high, but the cost of living is high as well. The most expensive one is housing, and then second one is the medical. If you are working in Singapore, employer will give you a very basic mandatory insurance that cover up to 60,000. But I would usually encourage my doctors to purchase additional insurance if they are staying here for the long term. It'll cost you about 1,000, 1,500 per year to give you additional coverage. These are the costs that you need to consider, because if you fall sick, for example, if you go to a polyclinic, it costs you about $30 to $50 per visit. But if let's say you bring your children, you need to visit the pediatrician. Children got allergy, some illness. I think it can cost $100 and upwards. And then that's what I have. That's what I experience with my children now. I can go to polyclinics. I toddler, if he falls sick, we will bring him to the specialist pediatrician. The bill is about 100, 120, 150, and if there's any investigation needed, $200. That's a normal. So this is apart from those hospitalization, right? If you don't have any insurance, my son got a small cut. It's a 5 minutes of procedure to stitch back near the nose, near the eye. It cost me about 15K. The surgical fee, the doctor, the anesthetist, the hospitalization, everything is about 15K. But we have insurance, then the insurance cover the bulk of it.
Wow, it is expensive. Like, so that is there any free healthcare there in Singapore?
There's no free healthcare. Singaporean has to pay for themselves, so we need to take care of our own health. Even when we fall sick, we are paying like combination of our MediSave and our cash.
Okay, so what's the process like now? Say I want to apply to become a doctor in Singapore. What's the process like?
You send your CV to me first. I go through your CV, I try to understand you better, and then I'll arrange a one-to-one call, right? This is a personalized call for me to share with you. These are the conditions that you are going to get in Singapore, right? For me to understand the doctor as well, your family, your plan, whether this align with the environment in Singapore. And then if everything is okay, I'll get you to update your CV, compile a document, arrange an interview for you. And if you're not confident, I can arrange an interview preparation session for you to prepare you for the interview. Once you pass the interview, I'll get you the medical registration, the work pass application, and then if you are a specialist, then we will apply for the specialist accreditation, and then the work pass application, dependent pass application, and then the relocation. Before relocation, we need to figure out like your housing, a lot of things, right? So that's part of what I'm going to guide you until you start look on the first day of work.
So I'm curious, is there a licensing body that is there a licensing exam that I can take to work in Singapore if I was a doctor?
There's no licensing examination. It's all based on qualifications. So that's why from very beginning we discuss about uh, the medical qualifications, whether your primary medical qualification or your postgraduate qualifications are listed on Singapore Medical Council's schedule. If it is listed, yes, you are registrable. If not, you can get registered. There's no examination at all.
Okay, so Wiryono, is there anything else that we didn't discuss here that you think is important for those doctors who, I mean, foreign doctors or Malaysian doctors who want to work in Singapore? Is there anything that you think we should talk about?
Yep. Coming to Singapore, a lot of doctors might be thinking that Singapore is a very glamorous place where we are going to earn a lot of money, right? Let's go there. But I have to be honest with you. Coming to Singapore is a hard work. You need to work, I think, maybe extra compared to what you are working back home. In Singapore, living is we are very stressful. Everything is very fast paced. Once you come to Singapore, it's only maybe 2 weeks of honeymoon for you, and then you are expected to be able to pick up you to build your own relationship with your colleagues, and then up to your own initiative to learn, to ask, to adjust well, and then if not, then you will struggle. So this is not a place for a lot of doctors. My job here is to discuss with you whether this is a suitable place for you to go. If I think you are the one of the this aligned with your long term plan and aligned with your motivation, then I'm more than happy to assist you until you come to Singapore, until you start work.
Okay, what's the benefit? What is the benefit of working in Singapore as a doctor?
I'll say if this align with your medical profession, you can work even working condition in hospital in Singapore is a fast pace, it's a stressful environment. But if let's say this align with your goal of wanting to learn more about medical skill, get more exposure, a lot of various cases, yes. So these are the benefits that you're going to learn, and then high standard of living, right? When you are coming to Singapore, if let's say you want to live in a better living environment, and then eventually you want to become a Singapore PR. So this is your first step towards achieving that goal. And then what else? I can't think of anything.
Is it so? I guess it's a merit-based system. If I do well, I can progress. Is that what it is?
Yes, correct, correct. A lot is also based merit-based system depend on your skill, depend on your initiative as well. They are not going to spoon feed you with everything. These are the information. If you don't know anything, keep on asking me. They will provide you with all the information that you need, but they expect you to learn, pick up first.
Okay, what kind of doctors actually is successful there? Like the type of doctors that you've seen, because you've recruited so many. Like, what are the kind of doctors that go to Singapore and then they will succeed?
It's very hard for me to answer this question. It's all depend on personal. Some doctors, some junior doctors, which I thought that he might not be able to take the stress in Singapore. Eventually, when he come, he can adjust very well, and then he clear his MRCP part one, part two, and then waiting for phases next year. And then I heard from his colleagues, his supervisor, that he's progressing very well. So it's very hard for me to say. Depend on the individual. So I say that the discussion is very important. I need to understand the doctor's situation now. What are your options? What is your options in Malaysia? Are your options in Malaysia might be better than the one you have in Singapore, right? And that will things in Singapore align with what the doctor is looking for. I think if we have this expectation alignment, I think the doctor can come, will have a very happy life and progress pretty well. When you talk about what's the benefit, of course, when you're earning Singapore dollar in a Singapore context, your savings might be not much, but when you are going back to Malaysia and when you travel overseas, then you can feel that things are pretty cheap everywhere.
That is true. If I go to Singapore, I feel like, oh my god, it's so difficult. But I suppose when from Singaporeans you come here, everything is insanely cheap.
Not insensitive but affordable. So even the clinical associate doctor, they are earning about on average I say 7,500 per month, 7,000 to 7,500 per month, minus and then minus off the expenses. Then I can see some of those Sri Lankan Bangladeshi doctor every quarter they can you suggest me where to go in Bali? You got a long weekend coming up. And then sometimes when I ask them how are you doing? Are you okay to meet up for coffee? I'm having holiday. I'm at Danang now. See you next month. It's Singapore is a small place, and then international flight everywhere is readily available. And a lot of doctors like they will arrange their leave and then they'll take leave for weekend getaway, like 4 or 5 days of travel, Hong Kong, Bangkok. These are one of the benefits that a lot of doctors are looking for as well.
Okay. Well, thank you, Wiryono. I think you've I mean, it's very enlightening to understand what the process is, what are benefits, and who is this suitable for. I guess it's not suitable for everyone. If it aligns with your long-term goal, then definitely go for it. So, for those of you who are listening in and are interested in working as a doctor in Singapore, you can fill out your application in the link below. And if you've been enjoying our conversation so far, be sure to check out our Disruptive Doctors Conference that's happening this 20th and 21st September, where like-minded doctors like you come together and share ideas and impact healthcare differently. And remember to download the Disruptive Doctors app and start connecting. And if you like this video, please share, subscribe, and like. And until then, I'm Dr. Selina. Keep disrupting the norm.
Thank you so much.
Before we dive back into this incredible conversation, I want to share with you guys. Mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025. And finally, if you haven't already, please download the Disruptive Doctors app. It is a global hub where you can connect, collaborate, share experiences with doctors across the globe, and you don't have to be limited by geography. This is more than an app. It's a movement. So be part of the community of doctors who are impacting healthcare differently. And also, can you do me a huge favor? If you have not subscribed to the channel yet, please be sure to subscribe because it's subscribers like you that help us bring better guests for you. So whether it's the workshop, the conference, the app, or just subscribing to the channel, be sure to do it now. Now, let's get back to the conversation.
Join Disruptive Doctors. Oh, oh. Disruptive Doctors.